Bionox is motivating wellness.
Really cool. So that leads us to a next question then, and you've danced around the gut and danced around some of these things. Let's really address this. So a lot of times you can specialize in a few of these really core major players when it comes to root cause health issues. So could you maybe just speak a little bit more even about these gut issues? What are you finding with the gut? What are you doing for it? What else are you seeing as causative factors for as a root cause problem?
Yeah. So it's unfortunate and why we see a lot more GI and skin issues in the US than a lot of other places is our overuse of antibiotics and also a lot of the chemicals that we have in our foods. And so when we kind of take that double whammy and you disrupt that gut flora from very early age. And so especially when we look at, some infants are born on antibiotics, if mom tested positive for strep B, if they're born by C-section, then if they turn around and have strep throat, ear infections, any of those types of things, and they're basically within the first 2 years of life, some kids have been on 7, 8, 9, 10 rounds of antibiotics. And that was my story. And so when we look at that and you wipe out that normal microflora, you wipe out that digestive process. So you do create, like you said, that fire in the gut, and we create that inflammatory process. Then we create a dysbiosis and overgrowth of what we call SIBO bacteria or yeast candidiasis. We create the overgrowth, and then as that bacteria creates a subclinical infection. So it's not an infection like we think, oh, we need another antibiotic to wipe it out. It just kind of hangs out in there and causes that inflammatory process, creating nutritional deficiencies, creating and what we call the gut-brain-skin axis. So it creates a reaction there. We're still, a lot of the research is new on this. I was fortunate to give a lecture on that last week in our last DAPSI convention on the gut-brain-skin axis. And we talked a lot about how your gut affects your emotions, affect your gut, and then you put in, again, that dysbiosis from the get-go. And then we see that's why things like psoriasis flare up when we're stressed. That's why things like hives come about when we're stressed. And it's one of those things that we have to understand there is a connection there. It's not just in our head, but it is in our head. It's our head talking to our gut and our gut talking to our head. So we take it from the skin side of things, but then some of the research I presented last week and was even looking at kids with eczema had a higher risk factor for depression and suicide. Kids with eczema had problems, more likely to have to go to a speech therapist for speech issues, right? And so we look at in patients with Parkinson's, with neurologic conditions, more likely to have skin conditions. So there's just no way to get away from this tie-in of the gut, brain, skin. And so that's, where it's, when we start specializing in that, it's like, well, yeah, we're specializing in this autoimmunity or especially in that, but when we start looking at the tie-in, it's not that we have a gene for psoriasis or a gene for eczema. We have some gene markers, but then if we pull in the food and the environment, we can see, like say we had a little bit of flame, but then we rub some sticks together and heat that flame right up there, and we have a full-blown cascade of that autoimmunity or chronic inflammatory diseases. You look at even diabetes and cardiovascular disease, and there's even association with those in the use of antibiotics. In fact, if a kid has more than 2 antibiotics before the age of 2, they're 50% more likely to have obesity or diabetes as an adult. And so, instead of talking about, hey, you had too many things of ice cream last week and that's what's causing your diabetes. Well, we have to go backwards and look at, no, you had this building up since it didn't start from last week. It started from 20 years ago and it just slowly kept building.
Right. Yeah. Good explanation. And so with these things like SIBO, which stands for small intestinal bacteria overgrowth, and other just gut-related inflammatory dysbiosis or bacterial dysfunction, you might say, what are some things that you have found to be effective as far as like protocol-wise in generic terms, outside of, I'm sure you work with their diet, what type of things supplement-wise have you seen to be effective?
Yeah, so we'll, kind of a three-step protocol for a lot of patients where we go in and use a natural antifungal antibiotic to kill off the excess overgrowth. I use like grapefruit seed extract or acrylic acid or oregano. And again, the nice thing about functional medicine, about nutritional medicine, is we have an arsenal.
Yeah.
And so a lot of patients have tried something. They tried the oregano, it gave them heartburn. They tried this, it did this. They tried this, it did that. Well, first of all, we can take that history and what they've tried and not tried. We can take that and go, okay, we learn from that. And so, we may have 5 or 6 different natural antifungals that we use. And it depends on that patient history. If they've got reflux, it depends on some of those types of things. We're able to use that. And then we go in secondary to the repair process. And we may use some collagen or we may use bone broth. And again, that may depend on the patient, their genetics. If they have a glutamate GABA pathway issue, we may not use something that has high amounts of glutamine in it. So we're able to adjust that and not just give one thing for every time we see SIBO, and every time we're able to adjust that to the patient. And even patients' choices as far as, if they're vegetarian or vegan or keto or if they have some religious, dietary preferences, we're able to really adjust that so that we can meet the patient where they're at versus them reading a book or hearing one thing and they fail at it because, it didn't fit their lifestyle or it didn't fit their religious belief or it didn't fit whatever it was. We're able to adjust that and meet them where they're at. And then, of course, we follow up then with the probiotics to restore that gut flora, and then the right types of foods to maintain that appropriate gut flora, and then all along the way addressing that inflammatory cascade that's been going on.
Very cool. Well, I know the healing really starts from the time that you get them in your chair, so to speak, because you're talking about things that from experience, and you're offering them hope, so they're already starting the healing process, feeling better. Knowledge is power. And then making these adjustments. I know that's why you're getting the success that you are. So that is really fantastic, and we appreciate those things that you're doing and the success that you're having. So I have a few more questions that we'd like to pose to you. So this, I guess, this is a little bit self-interest, I know, talking about Bionox. But we certainly love to know how you see Bionox fitting into as a tool in your practice, and how you use it, when you use it, kind of results you're seeing, that type of thing.
No, I have to thank you because, and I'm not really as good as I should be about talking to all of our nice, wonderful vendors at conferences, but some of the stuff you had there kind of intrigued me. And I will admit, cardiovascular is one of my weaknesses. But as an athlete, it's one of those things when I look at, when we start talking about that NOS, when we start talking about, how to get that nitric oxide availability up, it's something that I know is really important as that. So I would say we use Bionox really more on our athlete side, and then also on some of our cardiovascular patients, but again, not my biggest patient base. And it's interesting, I was actually in a cycling accident about 2 years ago. And so I found your product about a year into my recovery. And so it's been really nice. I actually use the nitric oxide support myself, and I mix it in with one of my electrolyte mixes, and I use it on my bike. So we're going to go out for a 5-6 hour ride like we will this Sunday. My husband and I both use that and I will tell you, not only my recovery time afterwards, but normally when it usually takes me that 30 minutes to really get my legs warmed up and loosened up and just like, do I really want to do this today? I don't have that anymore. So if I take about half of the Bionox, about half of a serving before I ride, then mix the rest of my electrolyte mix, both my husband and I are able to use that for recovery. And then again, be able to speak that personal experience. Now I have a lot of patients that we've been able to, again, boost their recovery and boost their exercise. And then a lot of our fatigue patients, we started doing the NOS strip testing. And it's amazing how many people are actually deficient in the NOS. And so we've been able to do that with our nutritional consults. And also we do genetic testing. So when we look at their 23andMe profile and we pull it into our genetic software, and we look at the fact that they're probably likely to have a NOS, I can just take the strip out and test them right there and say, yep, you are indeed deficient. Let's start this protocol in. And so we're able to get a lot of, not just our athletes, but a lot of people with that kind of chronic fatigue type of issue and be able to address some of that. But specifically because we know that they're legitimately low. So it's an easy way that we can test that. And so that's what's been really nice. Again, it's a very functional product that we can, drink this and we can retest. And, so it's easy for us to be able to really show them. They see it on the strip and they see and they feel it. So that's what's really nice about that.
Very cool. Well, I appreciate that endorsement of the M3 in particular. I think you've been using mostly in your practice up until this point. Of course, you can get M3 from bionoxusa.com. And I love what you're talking about as far as the athletic side of things. So many good research articles for pre-workout, during the workout, post-workout, lean muscle mass, recovery, endurance, stamina, exercise fatigue is better. So you hit on all the major points there that we're seeing with our athletes. The other cool thing is that when people are using it in that way, it's a clean product. So we don't use any artificial colors, flavors, any of those types of things. We use an arginine that it seems to be superior to other arginines, which I have experience with all of them really. The arginine alpha ketoglutarate, it absorbs better. It's less problems with the digestive system, which is good for your patients for sure. So yeah, thank you for that, and continued success in all the things that you do outside of the office, which we're gonna talk about that a little bit too as we go along. Some of the activities that you enjoy doing. So what do you, or I should say, why do you continue to educate yourself? Why do you look for new modalities? What makes you have your radar up for that?
It's science is always evolving. So, back in, that actually, as of this fall, I've been in practice for 20 years, and 20 years ago, when I was in college in chiropractic school, we were told to never give D3 to a patient with autoimmunity because their body's attacking itself. You're giving an immune system booster and you're going to create more of a problem. Boy, has that science changed. Now we're given 10,000 units. Now we're seeing, very legitimate research on it being a great antiviral in today's wonderful day and age, right? And so if we don't stay up on those times, we're really going to lose it. And honestly, especially in the day and age of social media, we no longer, again, I'm going to date myself here. 20 years ago, you went to the card catalog and you pulled out a book and you went and found the book on the shelf for a book you wanted to read. And only doctors had access to a lot of the research, to a lot of the information out there. And nowadays, your patients have just as much access, direct access as you do. So if you really think you're going to be able to coach a patient along or educate a patient on something, you better know not as much. And a lot of times that's hard because they've taken the time to look at their specific condition and they become an expert on that one condition. And so it's hard for us to be an expert on, the 25, 30, 50 conditions we see in the office every single day. And so I think any practitioner, it always, and I used to be I'm a past president for a state association. And it always used to irk me every time a doctor said, well, I got to get my last minute hours at, December, for my licensure. And I'm like, I've already got 100 hours. There's 20 other seminars I don't have time to take that I want to take. And that just always, did not resonate well with me, that you didn't want to, people don't, that certain doctors may not want to actually do that. So I think most of your good doctors, you have to forgive them for being out of the office a couple of times a year because they're at that seminar, because they're learning that process and they're keeping up on the current literature. And again, we've seen it in the last year and a half, Jay, as well as I do. We've seen the information change constantly, and we're all doing our best to stay on top of it, to really, and to know what's legitimate and what's hearsay and what's, being put out there. So we have to dive in for the benefit of our patients, for the benefit of ourselves. There's no way of getting around, continuing education.
Absolutely. A couple of things that I'd like to comment on what you said there. Number one is that one of your greatest educators, if not the best, is the patient that's sitting in front of you. Because as you said, they know their condition and have examined it. They know certain things that they've read as far as supplements, drugs, whatever it is. and your best thing to do is just sit there and listen and take notes.
Yeah.
and
Yeah.
and then go look at it yourself. And it's pretty amazing. And the other thing is, to your point, if you're really going to be your patient's advocate and help them in the best way, you got to keep up the best you can. So
Yeah.
having that hunger like you do, and congratulations, by the way, on 20 years
Yeah.
of
Thank you.
being in practice. That's fantastic. And again, I know you've got a ton of great success stories that we would love to hear at another time. So first, and the other thing I want to mention is we appreciate you being on. This is the first time we've had a woman on, so it's about time. So we got girl power going on today, which is great, and we'll have many more. Just worked out that way. It's not by design.
Right.
But so appreciate you being on and helping. So what is one of the best ways then that people can get in touch with you?
drtobi.com, just drtobi.com, drtobi@gmail, nice and easy there. Yeah, so I don't do a whole lot of social media. It's been a little tough in this day and age to keep up with that. But we do answer our emails and try to keep up with things from there. So yeah.
Awesome. Very good. So yeah, check out the website and see all the different things that they offer. There is a lot. And so if you're in that area, that would be awesome. By chance, do you do remote types of testing or?
Yeah, we do. And the nice thing also too about the DABSI program is that we are always happy to refer patients to someone in their area. There's a lot of amazing DABSI doctors out there. In fact, we just had a conference last weekend and reconnecting. And so, yeah, we do see people in Kansas and Missouri because that's what our licensure allows. But we be more, if you have questions or if you would like just to be pointed to someone that does what we do, what you heard today, I'd be more than happy to point you to some of my amazing colleagues. Because there's a lot of great docs out there that do this type of work and do it well. The nice thing about our DABSI program too is, my specialty is kind of the autoimmunity in the skin. We've got specialists in gynecologists, we've got specialists in cardiovascular. So even if it's something that, we do, but I need a consult with someone, I can pick up the phone and say, hey, just did a consult yesterday on a thyroid case that's very complicated, and pick up the phone and talk to one of my mentors. And so that's the nice thing too, is when you're seeing a DABSI doctor, a lot of times you're not just seeing that doctor, you're getting a brain trust of the whole program. So you're getting kind of that whole, one of the things we love to do at conferences is stand outside, talk about all of our cases, and and so you're getting a lot of that when you're seeing a doctor that's connected into their specialty program.
Yeah, these doctors are legit. I can tell you that. The information, the education, listening to the different chiropractors that were there, these are true integrative practitioners, and they know their stuff. So yeah, I appreciated your group very much. So we're going to go through a few little rapid fire questions here. And we know you're an outdoors person. So what's your favorite outdoor activity? I know you have a lot of them, but what would you say your favorite is?
Probably cycling. Yeah, definitely cycling. And I'm glad I still get to do that. Very glad. Yeah.
It's a good way to see things, isn't it? On a bicycle.
Yeah, we've actually cycled from Belgium through Amsterdam to Amsterdam. So we've used the cycling to see a different part in different ways of the world than you wouldn't get to see from a bus or from a car. So yeah, my husband and I we absolutely love to be able to see the world through cycling.
Really cool. And I know you love to travel. What has been your favorite travel destination and why?
Probably when we've gotten to a lot, but probably actually Cuba. Partly because we were able to run a half marathon there. And to see the cultural differences, riding in a car from the 1950s, they still use on a daily basis. And it's culturally, it's one of the most interesting places I've ever been, because there's so much politics that you talk about, but the cultural aspect of that is you see two very different sides of the story within, one street. So that was a very interesting place. Probably not the most beautiful, although it was beautiful, but probably the most interesting from a cultural standpoint.
That's really cool. I think I'd have to skip the half marathon because I'd be too busy in the coffee houses and the restaurants because Cuban food
Right.
is amazing.
It is amazing. Yeah. And especially too, it's interesting now that they do have a little bit of self-ownership in some places. You can tell the places that are owned by the locals instead of by the government, they go out of their way to make you happy. And the food, you're right, is amazing. So
Cool. Very cool. And where would you love to go that you haven't been yet?
Portugal, yes. And I've actually liked to do a little research on possibly retiring there. So yeah, it's a big cycling community, scuba diving, kind of all the things that, we're the coffee shops and look, all the things that in the wine, yeah, all the things that we look for in a, and luckily we're fortunate around here. We get a lot of things that we're able to do some of those things here too, but we're obviously we're a little landlocked. We don't get to get scuba around here.
Right, that's true. Yeah. And don't forget, wine is a nitric oxide booster
Right. Yeah.
in
Yeah. I got
moderation.
the resveratrol. Yep.
And cool. So, what is next for you as you look at sort of your career? I know you got plans to go abroad and do different things, but what's some of your next plans with your career?
Well, after my injury, I had a little bit of head injury with that cycling injury. So we did incorporate in some neurofeedback. So we just very fortunately, our patients have been very proactive with the whole COVID stuff. So we've been busier than crazy as far as nutritional stuff during this time. So we just didn't get the time and the chance to get the neurofeedback off the ground. So hopefully after our next little break here, after a little vacation here, we'll get a chance to really get that neurofeedback off the ground. Also, we are doing a lot of genetic analysis, and that's talk about learning experiment because that's just. And so I've got another 200 or 300 hours of education to do on genetics that I really want to be able to pull that into even a more advanced level. So if we can muster to get another chiropractor in the office to take care of the adjusting, then I can really spend some time digging into those two things.
Nice. And anything left unsaid? Anything that you'd like to say as we go our separate ways, or something that we didn't talk about that you'd like to talk about?
I think you covered a lot, Dr. J, and I do really appreciate this is an awesome opportunity, and again, and it's sometimes you meet people the right reason, the right time, and so I really do appreciate this, and it's one of those things that I've never been really good at doing the interviewing part, but I always love to be interviewed. So
right.
I appreciate your time to put together a nice set of questions that really does kind of let people know what's out there and what's available, and hopefully they can find someone in their area that's able to do this and to really give them the time that they need as a patient. So
yeah, you got it. Well, thank you for taking time out. Again, Dr. Tobi Jeurink of the Jeurink Family Chiropractic and Wellness Center. You can schedule an appointment or get information at drtobi.com, and you can reach out there and learn a ton, and that will help you out for sure. So we got a few parting gifts for you. We know that M3 is sort of your thing and what you've been working with, and it's our best product, our flagship product. Of course, as you mentioned, nitric oxide synthase, the eNOS pathway. That's what the M3 fits into. It's an arginine citrulline based product that works through that pathway. But the other thing that we just released is our nitrate pathway booster. And the cool thing about the NOx3 greens, it's 100 milligrams of nitrates per serving, naturally occurring. The main driver is arugula. So arugula is one of those, the therapeutic value of arugula is not really talked about much. We hear a lot about beets, which is also a nitrate-based supplement, if you will, or food. But then there's 26 other superfoods that are in there. It actually has 2 of the strips that you mentioned in there. So we work with Dr. Sean Green of the MyFit Strip team, real brilliant guy, definitely a nitric oxide enthusiast. So we teamed up with him, and so we get 2 of those strips in every canister there. So I love to start my day off with this, and then I do the M3, which I'm drinking here. later on and try to really amp up my nitric oxide and even create it while we're sleeping when you take the M3 correctly. So we got one of these for you, and would love to hear your feedback on that. Also know that you do and address heavy metal toxicity within your practice. And so wanted to also get you some of our Bionox product. These are all things that are basically like nutritional magnets. You know, they help to draw those metals out, encapsulate them. We support the kidneys and the liver with this as well, so that they have an exit strategy to get out. So we'd love for you to experience that. We've got a cool t-shirt for you that says Motivating Wellness. So we'd love to see you wearing that with pride. And we're going to get you a water bottle as well. So you got something to shake up your M3 and your Nox 3 greens. So anyway, we're so happy that you joined us today, and continue on your path of motivating wellness in your life and in your practice. And we know that your patients are very grateful that you're doing what you do.
Thank you. Thanks for your time.